In the interest of community service, Power 88 presents live talk shows to inform, enlighten, and to stimulate thought and dialogue. The views expressed on this program are not necessarily those of the staff and management of KCP or the EOB. Now sit back, relax, enjoy the program, and be sure to listen to Power 88 anytime from anywhere by downloading the KCP app.
Thank you for tuning in to The Big Promise. My name is Zach Robbins, and I am here with
Sarah Cirillo.
Sarah, it is so good to have you here today. You are a guest co-host. How are you feeling today?
Feeling wonderful. It's not every day that I have a chance to, participate in a community forum like this, and being given the opportunity by you and Patty Davidson is something that has truly brightened my day. So thank you for the opportunity.
Thank you so much for being here. And this is going to be an amazing day. We're here to give you 30 minutes of fantastic radio. On The Big Promise, we take a look at how the people we trust to act in our best interest, rather if they are elected or appointed, how they make decisions that benefit not a few of the people, not a handful of the people, but all of the people. We want to know if those who promise to take care of everyday people are keeping their promise. Every single episode, we come on the air and give you 30 minutes of the best that we can give you. The opinions on The Big Promise are not the opinions of your local radio station or media platform. These are our opinions. And today we will look at the promises made to us related to affordable health care and the availability of health care, particularly in the midst of this coronavirus pandemic. Now think about this, everyone. When we think about health care, we don't only consider physical health care, but we also think about mental health care and high quality mental health care and the availability of health care in general. And in my heart, Sarah, I'm telling you, my heart goes out to all the families that have lost just friends and families and loved ones due to COVID-19. I know I have several folks in my orbit who have lost multiple family members. I don't know if that's been your experience, but I have a lot of friends who've lost family members.
Yesterday, I was in fact just at a funeral for a COVID-19 victim, just 24 hours ago. So you're correct in knowing that it is ripping through our communities and it's affecting all of us, even if it's not affecting us in our direct family. What are we if we're not members of the community feeling the loss and the pain that's taking place with this pandemic?
In the community, this is the time where we're all just coming together and we're all recognizing just how much we need each other. And we're also recognizing how much we need to be cognizant of our need to take care of ourselves, not only mentally, but of course, physically, which is why this topic of healthcare is so germane and important right now. So according to the Center for Disease Control, for every 1 million people who seek testing, treatment, or care for COVID, it costs $5.3 billion. And one of the things I always wonder is, who pays for that? Who should pay for that? Because the truth of the matter is, everyone does not have health care. Everyone's job doesn't give them health care. Everyone, even if they have a job, they can't afford health care. But we know that when you don't have health care, it impacts the cost for everyone. So, and here's one of the caveats of COVID and healthcare. People are fearful of even going to the doctor. Folks are like, look, I'm not going to the doctor's office. They may have COVID up in there. They're the doctor, Sarah. Folks are now they're having difficulty just getting themselves together to go. And some are canceling these appointments.
So I promised the audience that Patty Davidson didn't set you up on this. But at the start of the pandemic, I had just been brought on as an analyst for a national home health and hospice company.
Oh,
And my role as analyst, it started February 24th of last year, was to parse the numbers of Medicare and Medicaid patients. And all of a sudden, I was in the medical industry, medical field, and COVID hit. We're headquartered out of Los Angeles. So by default, I became a COVID analyst for this national company.
wow.
And the issues you're discussing are what I watched unfold in the first days of the pandemic in Arizona, in Phoenix, in Los Angeles, in Las Vegas. And for 3 months, I traveled around briefing our different locations on just what you're talking about. In May of last year, I wish the audience would see what I'm seeing. Dr. Robbins' eyes are popping out right now as I'm telling him this. And how did I catch COVID myself? So a couple of being a healthcare company, a couple of my colleagues did come down with COVID badly in the opening days of the pandemic, mid-March, early March. I thought I caught it. In May of last year, we were in line for antibody testing, and I presumed I was going to have the antibodies. I received an urgent phone call. My blood test came back. My antibodies were so numerous that it was actually active. I had active COVID from the blood test. I had to go into quarantine immediately. Why did I catch it? How did I catch it? I was in areas of Phoenix, underserved areas of Phoenix, giving and doing outreach and giving COVID education to seniors who would not leave their homes due to what you're talking about. They didn't trust telemedicine. They didn't understand it, but they were too fearful to go out and get their prescriptions. I was literally going door to door in senior residences trying to educate these folks. And I know, due to the time frame and having had the blood draw, that that's how I caught COVID.
Wow.
And it was one of the most eye-opening experiences of my life, because you had seniors, anecdotally, but also through study, who were dying from the social, psychological isolation that was taking place and the fear of wondering, was their insurance going to cover the COVID? How would they get their prescriptions? So they were dying of not getting prescription medicines refilled. And also the fear and concern of what would happen when you call into the doctor. Were you really getting the doctor? They would hear the term hacking. They would not necessarily understand, is it a real doctor? Because sometimes it would be a nurse practitioner. And it was especially prevalent in the communities that were already suffering, in the communities of the Black and Indigenous people of color, of the Latino communities, which obviously the comorbidities were a massive factor in it, but so was the education. And so there I was, and as a company, we were attempting to educate on the issues and to tell them, number one, the government pays for it. You're protected from a senior point of view. You're protected under your Medicare, your Medicaid, but also through the CARES Act. You know, the CARES Act was defraying the cost of the hospitals with the COVID and the COVID testing. Yet that wasn't enough. And as who should pay for it? On that question, and I know we're going to get to the others in a moment, but on that question, when you are facing a global pandemic and you are trying to educate the populace, be it in a neighborhood, be it on the state level or nationally, you have to come together as a community and say the government needed to allocate that money and then educate the folks on what that money meant to their healthcare during the pandemic.
Zach Robbins, Sarah Cirillo, Big Promise Radio Show. So Sarah, you are literally going out to educate people, to help them, to help seniors in their homes, because they're too afraid to leave, because they are afraid that they are going to be infected. So you are actually going out. So you're doing basically, not even basically, you are doing the preventative measures so that people won't get ill, so that costs won't go up. You're doing the good work that needs to be done.
So I'll never forget this phone call. Keep in mind, I was hired less than a month before. and crunching numbers, Medicare, Medicaid. What this company assigned me to was to say, hey, every law coming through from the Center of Medicare, Medicaid, we need you to keep our doctors, our nurses up to date on the laws. And furthermore, we still have patients and potential patients that need to understand what's going on. I call in Los Angeles Health Department. 500 of us were on a call. And the call started with this: we do not have PPE for anyone.
Whoa, Sarah, hold it. You're on the call with the people that's supposed to help protect the people, and those people are saying, we don't have the stuff to protect ourselves.
That's correct. What little they had, they were rotating among a few hospitals. The CEO and I sourced PPE equipment at an air conditioning repair shop in Pasadena on PPP, that was a whole nother situation, on PPE, where we were getting masks for our nurses and doctors that had been re-imported from Peru. Somebody got their hands on it, and we were paying upwards of $5 a mask, not N95, but KN95, just so we could put something on our skilled nursing staff and our doctors.
And that's that's like a crazy markup, correct? I want to make sure the people understand. That's like a crazy markup.
Insane. Similar masks are now going for 40 cents.
Wow.
The goggles we were using, we went ahead and we would line up at Home Depot to get goggles to put on people because folks weren't showing up to work. We were offering hazard pay. They talk about hazard pay. We were having to pay a tremendous amount of markup to the staff in order to get them to work because no one knew what was going on and we had no help from the government. True story. Your audience is going to be shocked. I voted in 2016 for Donald Trump, right? I'm a capitalist. Mm-hmm. What the pandemic taught me is that healthcare is a community concern because I saw up close and personal, not from the side of being a nurse who's having to work an 18-hour shift, but from somebody who was seeing numbers that were changing daily. We had close to 100 employees across the nation, Arizona, Nevada, California, 3 offices, and it was bad, worse, and terrible in those 3 locations.
And all these people, and what you're saying is just what you're saying really shines a different light on some of this information that McKinsey and Company did their study on. It just all makes so much sense. You're bringing this to life. I mean, you're talking true life to the stuff that's academic for so many. So McKinsey and Company did this study and they found that 40% of the people in their study said they canceled checkups or treatment for chronic illnesses. And then another 12% of those folks said they needed to go to the doctor, but they just didn't schedule the doctor's appointments at all. So I'm up here listening to you tell this story, and I'm asking myself, imagine a person who has diabetes who can't get into the doctor, or a cancer patient who needs radiation treatment, experiencing these delays in their treatment or oncology appointments. There's this huge difference between someone who's just not being responsible with their own health and then the folks who just say, you know what, I am being responsible, but I need to go to the doctor for preventative treatment. And then you're telling the story of the people on the healthcare side seeking to do the right thing, wanting to do the right thing, who don't have either the tools or the resources to do that. Are you hearing that this sort of thing is going on now, or if you know, or is it that folks now have a different set of challenges?
So while I'm no longer with the firm,
right?
After I caught COVID, it knocked me out. I didn't have respiratory issues, but it truly knocked me out. And I realized that things were so out of control when it came to COVID, and the numbers didn't matter anymore, that I turned my attention as a strategist and analyst, turned my attention to more traditional fields that I'd been in. However, I remained close to the firm I was with, and I continued to do a little bit of contracting with them as different areas popped up. Mm-hmm. Where we're at now is that because we're always lagging, right? As a nation on important issues, we seem to be lagging. We don't really get to the forefront of things until we have to react. So everyone's talking about COVID testing, but now the question is, and I saw this in the middle of things, doctors were having to close up their clinics. Why were they closing up their clinics? They couldn't get permission to do elective surgeries. So without doing elective surgeries, no money was coming in. Everything was allocated to COVID. And quite a few doctors closed shop.
So they couldn't work. I'm always plugged in with folks who are on Main Street, so to speak, the folks who are doing the gig workers, the folks in the casinos, the folks in the service industry, who the money isn't coming in from their employer, so they're being laid off of work. You're telling me the story of healthcare providers, doctors who had to close shop.
So being in the home health and hospice industry, our industry depended on elective surgeries as well. If no one's being discharged, if no one needs at-home health care, different than a sitter, but actually skilled nursing in their home, we didn't have patients coming in. We didn't have folks coming in, nor did the doctors. There was a tremendous amount of retraction and contraction in the healthcare industry during COVID that people weren't talking about, because the hospitals were staying, quote, in business, but you had all these practitioners who, again, closing up due to the fact that there's no billing. No one was allowed to have surgeries. And what that was doing was creating a situation where, getting to one of your questions, who pays, who should be responsible, the diabetic, who should be responsible, the person with a heart condition. Answer the first thing you said, person can't get in to see their doctor, a diabetic. Telemedicine. How good, and this is what we always ask ourselves, how good is telemedicine when you're trying to examine a cut? How good is a telemedicine when you're trying to establish what a diabetic is going through at a very severe level? So the diabetic becomes frustrated and doesn't go in. Telemedicine doesn't cut it for them. What does that lead to? I'm sure you know this because it ravages the African American community, and I saw it myself. People losing legs, people losing limbs, and all of a sudden the cost of healthcare infinitely increases, exponentially goes up, when you could have saved that leg. And that is where the preemptive care comes in. That's when the preventative care must come in, and yet it was falling apart on two sides. And it became an acute crisis that did not get spoken of during the pandemic. Doctors who couldn't practice, patients who couldn't see people, and it wasn't about the money. But it's about the money now, because we're going to have a lingering crisis, sub-crisis we'll call it, that has nothing to do with COVID, but is because of COVID. So, which is that these issues were not being taken care of.
And listening to you talk about, the doctors who had to close their doors, and we talk about the patients who couldn't get into doors, and not just the patients with the elective who are looking for elective surgeries, but just patients in general who may say, why am I going to go? How can I do telemedicine if I'm having issues with internet connectivity in my community? You know what I mean? If there's an internet outage, my kids can't get online for school because of the internet connectivity for whatever reason, for whatever period of time, or maybe I'm just not very good on the computer or whatever.
So let's talk about the Navajo Nation, right? The Native Americans, it's a scourge. You can't put a word to what the natives, American reservations, specifically Navajos, are going through with COVID right now. And they put in lockdown measures, and they've put in very strict curfews, still being ravaged. Okay, what can we do? Telemedicine. Problem is, you still have to travel somewhere for the internet.
Right.
If you're 80 years old and your internet, be it if you are in an urban area or if you're on Navajo Nation, and you have to travel to get internet access, because that's still happening, or find a tool, a smartphone. We may take smartphones for granted, but there's areas where folks will never afford a smartphone or don't believe they need one. How does telemedicine help them? And on the Navajo Nation, the telemedicine gap was major. And what I saw in the urban areas of Los Angeles and Phoenix, and even in the certain urban areas of Las Vegas, a good friend of mine who's a teacher, she talks about it all the time, just what you said, the kids can't get it. And we're putting so much attention to the students, and I don't want to say anything critical about the schools, just in general, putting attention to them. What about the folks who have illnesses, specifically the over 65, over 70, over 75s, that are dying? And that's one of the reasons they're dying. And if they didn't die through COVID, all those healthcare issues that they had are building up. And now you're going to have to unravel 10 issues where we would have been able to take care of 2. And as a nation, what I'm afraid of is once this pandemic's behind us, as you wanted to ask today, who pays for it, Dr. Robbins? That's the question. Once this is forgotten, who's going to take care of all those people who have these lingering effects and or these silent comorbidities that ended up becoming accentuated and now all have to be dealt with?
Great. Fantastic point. Zach Robbins, Sarah Cirillo, Big Promise Radio Show. Right now we're into this issue of equity in how healthcare is provided. One of the things that our officials are grappling with is this equity in healthcare, and equity concerns with COVID-19 vaccinations in Nevada has now made national news. Cap Radio, which is actually based out of Sacramento, California, recently reported on COVID-19 vaccinations administered in Washoe County. And they reported that the Latinx community only received 9% of the vaccinations, though they made up a quarter of the total population in Washoe. African Americans made up 1% of completed vaccinations, very much disproportional to the total population in Washoe. And in Nevada as a whole, only 5% of the vaccinations have gone to African Americans, but African Americans make up 9% of the state's population. So Sarah, if we expect our officials to keep their promise to keep us safe during these times, what are we to think of this data? What are we to take away in terms of the equitable access to healthcare?
So the easy answer is, what are we supposed to take away? We're supposed to take away the fact that systemic racism has found its way into the pandemic. That's the easiest term. That's the easiest way to put it because it's a fact. Systemic racism is showing itself in the pandemic. And I listened this morning, this one-shot Johnson & Johnson is now going to be focused on people who are considered less than, maybe the dehomed folks that are not expected to be able to do follow-ups. Great. But the rate of protection of this single-shot Johnson & Johnson lags behind the other 2 vaccines that are already out. And if you look at pre-pandemic, you would go along the border areas, and some of the highest healthcare costs in the nation were in these Latino majority border towns, McAllen, Texas, and some other areas that had markups significantly higher from the hospitals than you would find in more affluent areas. And that's because they were able to prey, in a sense, on these folks, knowing that nobody was going to really negotiate rates on their behalf, and that they were able to also, in a sense, take advantage of if you live in a food desert, right? If you're living in a food desert and you're eating food from a gas station because there's no grocery store around, or the grocery stores have major markups. You know where I'm coming from on this, because in urban areas, oftentimes grocery stores don't exist. Also in poor country areas and rural areas, we have the same issue.
Right.
A mutual friend of ours lived in Mississippi. We were just talking about this before the show. And I saw this in the Mississippi Delta, where you would go for 50 or 70 miles and not see a grocery store.
Right.
So what does that lead to? That leads to obesity. Obesity leads to a tremendous amount of health problems. But is it really, and here's the question, is it the fault of the person who, eat better and exercise? Okay, fine. We can all be responsible for exercise. Can we all be responsible for eating better? I don't know if I'm supposed to drive 70 miles to get to a supermarket
to buy healthy food.
Or am I going to go to the gas station,
right,
and pick up, they might have a little diner, not even a diner, but they make some food in there, oftentimes fried. and I'm going to eat that, and I'm going to eat a bag of chips with preservatives and maybe a banana as my fruit. And that too allowed me to say, hold on, what's going on with healthcare versus what should be going on with healthcare? I'm in great physical shape, wonderful. I try to eat right, but I have the opportunity to do that. In Mississippi and in certain urban centers, East Phoenix, certain areas of Los Angeles, certain areas of Las Vegas, there's not going to be the ease of access to food, let alone the education of what goes into it.
Right. That makes sense. You know what? Zach Robbins, Sarah Cirillo, the Big Promise Radio Show. And Sarah, it's almost time for us to wrap up. So I want to talk about and check in to see if the Big Promise, to see if it's being kept. Now, are these officials keeping their promise related to affordable health care and the availability of health care in the midst of this coronavirus pandemic? Do you think that this promise to make sure that we have access to health care is being kept?
No, it's not being kept. Again, it's being kept for certain segments of the population who have always been afforded better opportunities. And where does that come from? That doesn't come from the education sector you're in. It comes from the larger sense of educating communities and then serving those communities. And here it is. Again, systemic racism is existing within the coronavirus pandemic. We've had headlines for a year. Something's going on to the Latino community. Something's going along to the Native American population. Something's going along to the African American population. And what's happened in a year? A year later, the vaccinations are still not getting to the communities that are hardest hit. We know that those vaccines do not stem the coronavirus, but we know it saves lives and we know it stops illness. So why are we not making those go to these communities that have the highest percentage of death and casualties first is a question that only the stakeholders can answer. But it's on the Big Promise, we can answer and say, no, the Big Promise is not being kept for whatever reason. And it's in the data, and the statistics in this case do not lie, and they're showing themselves in real time.
And Sarah, I have to agree with you. I believe in this instance, the Big Promise is not being kept because, you know, there are amazing things that you can do with block grants to make sure that you can provide more access to healthcare. More access to healthcare means more availability to get healthcare. So I believe that there is more that can be done on a national level to make sure that we give more energy, more enthusiasm, more access to diverse communities, let alone all communities, because the data tells quite a story. So everyone, I just want to thank everyone for listening today. I'm Zach Robbins, and I had the pleasure of being here with Sarah Cirillo, an amazing guest host. Sarah, thank you so much for being here with us today.
Dr. Robbins, I hope that your audience will have me back. It's been a pleasure. And one thing I know is that sometimes you have to speak your mind on important issues. So thank you for having this show, and thank you for having me on today. It's been a true pleasure.
Absolutely. And it's been a pleasure to have you here. And I know our audience, I know they enjoyed the fantastic things that you've brought. And thank you to our sponsor, the Las Vegas Lawyers, where it's not about the injury, it's about the recovery. And if you're out there, please pick up my new book, Restorative Justice Tribunal and Ways to Derail Jim Crow Discipline. You can pre-order that on Amazon. We look so forward to seeing you next time on The Big Promise. Thank you for listening, and good day.
If you need information on KCEP special events, programming features, community bulletin, upcoming concert information, employment opportunity, or just want to listen out of town, log on to power88lv.com.